Welcome. I'm Alvaro Gurovic. I'm the editor-in-chief of the Cardiopulmonary PT Journal, and we have big news for the 2026. So happy New Year, first of all, to everyone. One of the major things that we have for this year is that we're going to open a new type of submission that is called Methods and Protocols that Rich Severin and Darlene Reid has been working on the instructions for authors, and they will be updated very soon, in a week or so, in our website. And we wanted to do this webinar so people can be aware of the new submission and do the best on when they are submitting their protocols or methods. So no further ado, I really want to introduce both of our speakers, and I'm going to hang it to Rich that he has a few other words before Darlene takes over.
Thanks so much, Al. So I am Rich Severin. I'm based here at the University of Illinois at Chicago. I'm a faculty member here and essentially the assistant director of the DPT program. Darlene's going to be the main feature for the show. She's spoken at length and I think published at length, for protocols and methods papers. So the thing that I just wanted to kind of introduce, like Al had mentioned, that this is a newer line, really a really new emphasis for line of submissions for our journal. It's something that's been around, protocol and methods papers. The thing that I hope people take away from this webinar, and I'm sure Darlene will get into this in more detail, is that realizing that not all research has to be exactly an RCT. Research is kind of a journey, step by step. Research or protocol papers and papers have their place. There can be peer reviewed research products that can contribute to your scholarship and they can contribute to the line of investigation for particular topics. So it's a nice starting point. You can view protocol papers kind of as like, here's a study like we're about to do, here's why it's worth doing, it's a way to think about it. And methods papers like, hey, here's a technique that we do or an approach, and here's how to do it really well. And this can be very useful for colleagues in the shared kind of academy of research. No pun intended, because we're the Academy of Cardiopulmonary PT. And why we want these, because it gives kind of methods and protocol papers can be kind of practice or research shaping resources that can be used in subsequent research investigations. Again, it's thinking about how to make research more of an incremental process versus just in spurts. And that we should, anyone, who should consider submitting one. So it could be clinicians and, looking into certain, developing certain protocols or have novel ideas that they want to kind of, maybe have fleshed through the peer review process. Or people looking to standardize practice, people looking to standardize research methods. And again, the key thing to kind of remember that it's a scaffolding for better evidence. It's part of the research process. These can be peer reviewed. These will be peer reviewed if they're submitted to the journal, and they have a utility that extends far beyond I think than people realize. And again, just reframing, what we view as like good research beyond just RCTs, and then realizing there's components that go into making actually even a really good RCT, which I think starts in some regards with good protocol papers and good methods papers. So with that, I will hand it over to my colleague, Darlene Reid.
Okay, well, thanks for that introduction, Rich. And I couldn't agree with you more. They're really a stepping stone. And there's also a way to share your research protocols or your research methodology so it can be they can be used with different types of participants with different kinds of conditions, and also to address areas that we may have seen in physical therapy, but they may not be being applied to cardiopulmonary physical therapy, and they're just questions waiting to be answered. So I'm a professor at the University of Toronto in the Department of Physical Therapy. I've been here for a while. I was at University of British Columbia before that. And I won't spend too much time introducing myself except the fact that I love the research process. I've been doing it a long, long time, and I still very much enjoy it. So I'm going to be going through some slides. We're a small group, and I think if you have a question, please unmute your mic and ask the question. And I'll be stopping to see if you have questions as well. Okay, I'm going to share screen, so just a moment, and let's see if I can do this properly.
Well, Darlene is uploading her slides. Two housekeeping. One, if you want to ask a question, raise your hand with Zoom. I will be monitoring that and let Darlene know. Or write your question on the chat, and I also will be monitoring the chat. So.
Yeah, and I'm hoping people can hear me. And if they can't hear me, make it known. So. Okay, so writing to publish methods or protocol manuscripts. I think the main thing we're going to do is walk through the content of writing such a paper, and we're going to stay a little bit away from the formatting. We'll address formatting a little bit, but mainly how to shape that paper. So key things that we're going to talk about are how to shape the introduction, how to include the details in a step-by-step protocol, and how that might be different than if you really focused on methods. So really we're talking about two different kinds of papers, a protocol paper and a methods paper. Some of the things to think about for providing sample or pilot data, and discussion points. And some of these are quite similar to a research papers, but others are very, very different. Okay, just to check in with the audience, how many of you have authored a paper, and this is confidential, we're not going to take it back to identifying who responded in a particular way, but how many people have authored a paper that was submitted for publication as the primary author, contributed a section to a major paper, only wrote a research paper for a university course, or no experience in scientific writing? And if you go on the QR code and put your answer there.
So I can share the results with everybody. 4 people have replied, and everybody has been a primary author.
Great.
On submission, a manuscript submission.
Okay.
6 out of 6. We jumped. 100% of first author.
That's fantastic. Okay, so there again, as if you have questions as we go along, please put up your hand, and I'll be stopping and asking for questions. So as far as the general format of what I'm going to go through, I'm going to talk about the title page, abstract, the introduction, step-by-step protocol or methods, and try to contrast those two papers with some examples, some of the things to think about for sample or pilot data, how the discussion is shaped actually quite differently than when you're doing a research paper that's describing a particular study. And of course, for this journal, we're looking for clinical pearls. For references, you'd be referencing the same way that you reference any sort of paper. There's nothing that different with a methods or protocol paper, except you do use a lot of references as you go through. And some of the things to think about for the supplemental appendices. So I guess in writing a paper, and with any research paper, including methods and protocol, we want a clear, concise paper with a focused message. So you want to keep the reader on the path from the introduction to the method or protocol, provide some sample or pilot data. Can you see my, my mouse? Great. And then go on to the discussion with main application, advantages, and limitations. And probably the most important thing is when you're writing the introduction and the discussion that you're not really doing a review of the literature, but you're really focusing on the research question, and you're discussing the you're getting to the methodology, and when you're doing the discussion, you're discussing the methodology. So there's some divergence from what you would consider when you're writing a research paper per se that's talking about a full-fledged study. So I like this quote by Anne Lamott. It's Bird by Bird. She writes fiction, and I've often thought about how how I wish I could get it right the first 2 or 3 drafts. But she writes, almost all good writing begins with terrible first efforts. You need to start somewhere. And I've been doing this for a long, long time. And even when I write papers now, oftentimes I'm at 8 or 9 versions of the paper, because I'm always looking at what my co-authors have to say and how I can present it better. And eventually, you know, we all put our arms up and we're happy, or happy enough, until we send it off to the editor. So in developing your paper, if it's going to be a protocol or a methods paper, the first thing you need to do is to identify key noteworthy results to date and future applications. So it doesn't have to be cutting edge, but it has to be a novel approach that's different in its application to our particular group of participants. So what is new and what can contribute to the topic? How can your paper present something in a novel aspect that's relevant to the readership of this journal? And do the results have implications for clinical practice, policy, education, or future research? So depending on your area of research, you may focus on one or more of these areas. So in building a methods or protocol paper, probably the most important focal point is the purpose. And sometimes people state it as the objective or the aim. And this is something that should be and always looking at you when you're writing this paper, but it can be refined as you move along, but it still is the focal point of the paper. Another thing to think about very early on is to identify the novelty of the pilot or sample data. What is interesting and what is new about that data? How are you looking at this methods or protocol that is novel in its application to people with respiratory or cardiovascular conditions? And almost hand in hand is how to describe that step-by-step protocol and methods. So those are usually the first few things that you're thinking about and writing when you're thinking about a protocol or a methods paper. Oftentimes people write the introduction very early on, but I find if you write the introduction too early, it tends to be a summary of the data. It tends to have too much background information. Whereas when you focus on the novelty of the data and the protocol, the introduction can be much more focused to the purpose, the objective, or the study aim. The discussion is probably one of the most challenging aspects to write, because there again it needs to draw from what you've already written rather than just being a literature review. And writing the abstract last. I find the abstract probably one of the most challenging aspects to write because it has to be brief. Usually my first draft is way too long. You want to cut out information, but you don't want to lose the essence, the novelty of the paper. There's no questions today. Okay, so the sequence of the paper. The following slides are in the sequence that each section will show up in the paper. However, the order in which you write the section may not follow the sequence, and one of the recommendations that I have is do the step-by-step protocol and methods first. It requires the most work for this type of paper. I find it probably the most straightforward in terms of determining the content. But it still is really time consuming. The results are always considered initially because, as I mentioned, you want to be sure that the methods address a novel approach of looking at data. And then the introduction, followed by the discussion. And then the title and the abstract, I usually address last when I'm writing a paper. I might draft it earlier on. A lot of people that I work with draft the abstract earlier on, but I think you want the abstract to be really finessed, even though it's incredibly brief. Okay, the title. This is the last part of the paper that you should develop, and there's key information that needs to be there to capture the editor's and reader's interest. You want someone to read the title and say, aha, I really want to read this paper. This paper looks like it's sort of cutting edge, or this paper really suits the sort of work that I do. And I think since most of you have written papers, major papers, you're probably familiar with the PICO framework, where you have participants, intervention, comparisons, and outcome. And you should consider this PICO framework when you're looking at or revising the title of your paper. And you always get interesting comments from your co-authors and also some suggestions from the editor or the reviewers of the paper. Now, I've listed some methods papers here, and I'm not listing these papers because I think they're the best papers. They're papers that I've co-authored. I'm listing them because I can criticize my papers more easily than I like to criticize other people's work. So these are a couple of examples of methods papers. The first one by Ahmed Hassan, Motor Cognitive Analysis of Dual Task Walking in Chronic Obstructive Pulmonary Disease patients, an observational study using functional near-infrared spectroscopy. And when you look at the elements in this title, there's definitely the participants, there's the dual task walking, which was the intervention. The comparison is inferred, single task versus dual task, and the outcome is walking as well as functional near-infrared spectroscopy. Now contrast this with the paper by Antonio Rodriguez, Acquisition and Semi-Automated Analysis of Respiratory Muscle Electromyography. So there is the outcome and the measurement tool, EMG outcomes, but some of the other elements are missing. So when you look at the title of your paper, it may have the PICO elements, but it may not. If you're doing a protocol paper, usually it will have most of those elements. This is a protocol paper down here, and when you look at it, it does have all the elements that you would expect when you look at the PICO framework. And these are actually 3 different journals that you might look at if you're wondering about how to put together the formatting of and the content of your paper. Plus One, Jovi, the Journal of Visualized Experiments, and this is JAMER. And I can't remember what JAMER stands for, but if you put it in, you'll find it. So as far as the abstract formatting will be somewhat similar to what's already expected from for the journal. There needs to be an introduction that leads to the research question, and then you state the purpose. Some people use the word aim or objective, and then you would describe the essence of the protocol or the methods, a brief description of how it relates to the main finding, some key information about the main outcome of the sample data, and for the discussion, the novelty or the merit of the application. And as mentioned, I find the abstract very challenging to write. It takes a lot of time to write, and it takes a lot of time to sort of tweak it and pare down the word count. It needs to be brief, but it also needs to contain all the key information, and what I'm always looking for is to catch the editor's attention and the reviewer's attention, so they see this as an exciting paper before they move on to the main components of the paper. Formulating the introduction. I think I'm just going to move somewhat quickly through this because all of you have put together major papers. Formulating the introduction, I tend to use a funnel approach where I start very broad. I might define the condition or the pathophysiology, its severity, health burden. I might define an intervention in that sort of section. But probably the most important thing in a methods or protocol, why is this method required? And why now? What is the controversy that's going to be resolved? How is this method going to be better than what's out there in the particular context of your research and your clinical question. And then the last little bit, it identifies what's known, what's not known. And I think the key difference in writing the introduction for a methods or a protocol paper is it tends to be shorter. So you need to get this in sort of 3 or 4 paragraphs. So by the time you've written the introduction, it should be obvious to the reader that this is urgent or this is very timely, that there's a need for this method or protocol. That should be obvious. So in some ways, you're focusing more on the methodological approach than the healthcare burden or pathophysiology. What is so much better about that methodology? So I'm going to give you an example. And the example provided is looking at a paper that looks at the decrements of hand dexterity with loaded breathing in older and younger adults. And the reason this is a study that hasn't been published yet because I didn't want to, there's nothing that's been published in cardiopulmonary physical therapy, and it would be difficult to borrow papers from other journals. So in this particular example, formulating the introduction, where we would start initially would start very broadly. Some of the first topics the first paragraph might cover is that older adults require hand dexterity in their daily activities. Dyspnea induces cortical activation. Dyspnea or breathlessness is more common as you get older with aging. But neural efficiency is less with aging. And and then the next paragraph could address that dual tasking is cognitively demanding. That is, when you do 2 things at once, we don't do them as efficiently. We think we might, but most of the evidence points to the fact that we don't. When we multitask, we usually leave something out. And the other thing that could be discussed is dyspnea is undertreated. Oftentimes we consider it as a sensation, but when we're breathless, we're recruiting more respiratory muscles, and there's higher motor control demands. So really, when you're breathing heavily and doing another task, you're doing 2 things at once. And then this could point to a test, a hand dexterity task with and without loaded breathing that could be used as a fundamental test to see if it's an issue in that particular group of adults, and it could be used as a test to look at the effect of training. And the most obvious training might be inspiratory muscle training or some sort of other type of training that reduces breathlessness. So this is an example of how we start broad and then we come narrow. And then at the end of the introduction, that is within about 3 paragraphs, the study purpose should be obvious. And these are some examples of purpose or aim or objectives that were used in the papers that I just mentioned. And again, I always try to think about the PICO framework. The first paper by Ahmed Hassan, the aim of this study was to describe a dual task protocol with a cognitive task to assess related decrements and associated change in O2HB in patients with COPD and older adults. So when you look at this aim, there is the participants, COPD and older adults. Really, the intervention, or what we're looking at, is the protocol of walking with and without a cognitive task. And the outcome, is there a decrement in walking, the cognitive task? And the other outcome is the change in O2HB. So in some papers, the aim may contain all the PICO elements. In this paper by Antonio Rodriguez, this study outlines a protocol for acquiring and analyzing respiratory muscle EMG signals in healthy adults and patients with respiratory health conditions. As you can see from the title, he mainly had the measurement tool and the outcome, but in his purpose, he was able to add the participants as well. And then there again, if we go down to this protocol paper by Dmitry Rosenberg, it does have all the PICO elements. So again, when we look at a methods paper, sometimes the purpose may or may not have all the PICO elements, but usually with a protocol paper, we're looking for all the PICO elements. Okay. Now, I don't know if, do you want me to pause there, see if there's any questions, or shall we go on?
Might be a good time to ask questions.
Pardon me?
Might be a good time to ask questions.
Yeah. So do people have questions?
Hey, Darlene. It's Mary Fisher. Can you hear me?
Yeah, I can hear you.
Oh, great. Thank you so much. Learning a lot. I want to make sure I think I understand. A methods paper is what you did, and a protocol paper is what you plan to do. Is that accurate?
Ah, that's a good way to do it, to
Oh,
describe it. It all depends on the confidence you have on the manner in which the methods or the protocol was carried out. So in the methods paper that I've written, I've already done the studies. And when I say that I've
yeah,
written it, it's with colleagues of mine.
yeah, yes, of
So we've
course.
already acquired a lot of data. With the protocol paper, oftentimes you can write it very early on, but you should have some pilot data.
Oh,
And
okay.
you might not have the pilot data in the protocol all carried through, but you need to have a lot of confidence that each aspect of your methodology is going to work.
Wow.
Now I'm just going to go back to this one. So in this paper by Dr. Rosenberg, Dmitry Rosenberg, we hadn't put anyone through the randomized control trial, but we had high level of confidence that the cognitive training would work and a high level of confidence that the physical training would work. So there was evidence in the literature and in the people, with the experience of the people that we were collaborating with, that they were well-established cognitive training and well-established physical training, but not necessarily applied to this patient group.
Okay. Okay. Thank you so much.
Yeah. Thank you for the question. Good question. Any other questions, or should I move along? Okay, I'm going to move along. So when we look at the methods or a protocol, there needs to be an ethics statement. So there needs to be ethical approval, ethics approval from your institution or institutions that this study has been reviewed and accepted. There's a description of participants, but one thing that may not be included is the sample size calculation. You might include it for the protocol, but it's not required. It's important to describe the setting, whether it's in a lab, a hospital, home-based, or community, and if it's in the hospital, what aspect of the hospital. There'll be an outline of the research protocol or methodology. There doesn't necessarily have to be an intervention. So some of the methods paper that we did on dual task walking, and we've done a couple more. The EMG paper, there wasn't an intervention there. Sometimes there's a perturbation, but when I say an intervention, it doesn't necessarily have to be a week-long or several weeks of treatment. As far as the data collection, there should be measures that you're going to use to characterize the participants and characterize the intervention and characterize the outcomes. The statistical analysis, there may not be a statistical analysis but that you're doing with the sample data, but you can allude how you would describe the data with both descriptive and inferential statistics. So first I'm going to provide an example of a protocol. So with a protocol, it's pretty much inclusive of all that you will do with the patient or participant. It's described in chronological order. It needs to include the details of particular methods, and I'm going to give you an example in just a few moments. But you don't need to describe the details of well-published standardized methodology for certain tests. An example is spirometry. Standardization's been out there for the better part of a couple decades. Questionnaires, the example I've got there is the MOCA, known as the Montreal Cognitive Assessment, or BORG. You can include them as supplements, but you don't need to have the details unless you're going to do it differently. Now the MOCA, there's a standardized ways that you can do it. With BORG, I've seen the instructions many different ways, and I've seen the instructions been published in standardized protocols in many different ways. But if you're using a standardized methodology but requires some adaptation for your political setting or your particular setting, you need to describe those modifications. And the thing I'm considering is, sometimes we go into the intensive care unit and there almost always seems to be some modifications that we do. There again, I'm going to use the example of how parts of the protocol could be stated. I'm not going to go through all the details because it would be way too long, and it may not be that interesting to listen to a long-winded description. But in this study, looking at the decrements of hand dexterity with loaded breathing in older and younger adults, how would you start writing the protocol and how much detail could you include? So with a protocol, it includes the details of the initial interactions and less details on the particular methods compared to a methods paper. So this is an example of some of the headings that could be included. Recruitment and screening, and how you go about recruiting, eligibility, inclusion and exclusion, some of the things that we used for screening, the approximate length of the expected length of the visit. It's numbered, and it's numbered in a particular fashion. The other thing that is important is it should be referenced. Anything that requires a reference in a research paper where you're describing the research study, you need to include the same level of referencing in a methods or a protocol paper. Informed consent, if we were just doing a research paper, we would say informed consent was obtained, and we'd probably state the protocol number and the institution or institutions that it was acquired from. In a protocol paper, you may describe the particular manner in which you acquired informed consent. And there may be some special considerations, especially if you're working with inpatients, if you're acquiring informed consent from patients in the intensive care unit. And there again, even characteristics of the participants. This is more detailed than what we would include in a research study. The spirometry, again, we would cite it differently in a research study, but notice how this is pretty standard methodology, so you probably just need to reference it. Getting down to questionnaires, oftentimes in the studies that I do, we use questionnaires to have a more fulsome description of the participants as they come into the study, and we also have questionnaires that we use to characterize their response to testing. And again, you would include those questionnaires and you would fully reference them. If there's like the Montreal Cognitive Assessment, there's a standardized ways that you have to administer that test, so you would allude to the fact that it was applied in a standardized manner. The other thing that you might state, if it's a long protocol, I work with people, COPD patients, and I have sort of a standing rule that the protocol shouldn't be longer than 90 minutes. In this study, we were working with older individuals, so you check in at a particular point to see if they need a rest, and that's a statement that you could include in your protocol paper. And there's natural places where you may want to pause the experiment. So usually the natural place is before, in the studies that I do, is before I attach them to different pieces of apparatus. Okay, I'm going to give you an example of ventilatory setup, how we would describe it in a protocol versus how we would describe it in methodology. There's step-by-step details that are provided in protocol, but not to the same extent as a methods paper. You turn on and warm up the devices. You would calibrate the pressure transducer, calibrate the flow, and then attach a viral or bacterial filter. And then you position the participant at the breathing apparatus so they're comfortable. And so in this particular study, they're going to do a hand dexterity test so they can so you position them so they can see the 9-hole peg test. So just if you look at the detail here, and just keep that in mind when I contrast that for a methods paper. So you include the particulars that are very pertinent to your setting. This may be especially required if you set up your equipment in one room and then you move it into a hospital room or you move it into the intensive care unit. You might have a picture like this or a diagram where you're labeling the pieces of apparatus. And probably one of the most important things to keep in mind if you have a person shown in the picture is that their identity is blinded. Okay. For methods, you still need ethics. You still need ethics approval in the settings that you've used that particular methodology. And there again, I'm going to use the same example where we're looking at decrements of hand dexterity with loaded breathing in older and younger adults. Each of these methods could be included in the protocol paper, but in a much more abbreviated manner. So if I'm describing the ventilatory setup, I could use a very similar picture, but there's many more details as you go through the step-by-step. Turn on the monitor. You would state the particular apparatus that you're using. You would state some of the switches that need to be turned on and the order in which you turn it on. Log into the computer with your user ID and password. You wouldn't state your user ID and password, but you would state that you would need that information in order to log on. The particular type of software. Usually the commands are, in this case, are indicated in italices, and then you choose the appropriate template and you check all the connectors, and then there's details for each of the main components. So turning on and warming up the devices rather than just stating it, there are particular details that need to be provided, and then calibrating the pressure transducer. There again, there's a step-by-step process that you go through when you're talking about setting up the pieces of equipment. These are provided in chronological order. Many of the details pertain to a particular piece of apparatus. You might have pictures of the apparatus. You have to make sure that they're pictures that you take, or you have permission from the manufacturer to use pictures if you're taking it from the manual. In thinking about this, this is more than the instructions that you would read in a manual, and oftentimes you're integrating the instructions that you would read in the manual for a particular device, and you're integrating that as you're using devices from different sources. And there again, with the ventilatory setup, this is the information that we would include for calibrating the pressure transducer, and then calibrating the flow, the flow for the device. And there again, it's a step-by-step instruction. Basically, you're providing instructions, so if someone has those pieces of equipment, they can follow through those instructions and carry out that type of methodology. It also enables people to critique it as well, because it's peer review. Need some good questions from the peer review. The 9-hole pegboard. This is interesting. For the 9-hole pegboard, for a protocol, you may not include quite as many details, but you would include some details. For the methods paper, again, it's a step-by-step where you're asking the person to sit in a chair, and you're adjusting the table height so they're comfortable. You're using a chair that's not a wheelchair. The table height is adjusted, and the pegboard is put in the midline of the individual. You provide the instructions. You would include the instructions word for word, how you would go about instructing the person. When you look at the numbering, what we recommend or what we would require is use numbering in this way, and if you're using the secondary point, it's 2.1. If it's the tertiary point, it's 2.11. But you can see that there's a lot more detail in the methods paper than what you would include in a protocol paper. Should I stop there and see if there's questions again? Or should I carry on? Any hands up? I can't see your hands up.
I have a question, and piggyback to what Mary was saying. It looks like the protocol manuscript is some sort of a big picture, and the methods one is more on the specific tasks that the subject or the patients are asked to do. Would that be a good difference between a protocol and a method paper?
Yes, yes. So the protocol paper would be considered, if you were doing a study, the protocol paper would include the entire plan of what you were to do. But if a methods is taking one particular segment, that might be really challenging. You know, that's why we did the EMG, and we were looking at the timing of EMG. And then we really dive into the specific steps so people can critique whether we're actually measuring the timing of the EMG. Yeah. So it is a very focused view versus the protocol is a higher level view. Rich, did you have a question? Or a comment.
Yeah, I would agree with that assessment. You know, I think the analogy, it's kind of like what you did in a certain sense, or very specifically like what you've done. Protocol is more kind of like, it's more comprehensive, and it can include potentially multiple like methods, but not as specific and detailed as a methods paper.
Yeah, and it almost always does include a number of methods. Okay, so now I'm going to talk a little bit more about the next component, and that's the sample data. And you will provide it in the text. You may also have a table or graph format. So often in a protocol, we think about that as pilot data. Pilot data just to show the reviewer that you can actually do the study, that it's feasible. With methodology, again, you're illustrating that this methodology is feasible, and ultimately it will provide the data that you intend for it to provide. The data is really a snapshot. It should reflect the overall expected results, but you don't focus on unusual findings. You need to present it in a manner that maintains ethical standards and confidentiality, and that's one of the challenges. You may select 2 individuals or 3 or 4 individuals. One of the things that we do at our institution, if we're citing data on a particular person, we use the decade of their age, not their specific age. And we really think hard about any identifying features, because if a colleague was to read the paper, a colleague that wasn't involved in the study and they read the paper, could they identify that person? We don't want them to be able to identify that person. So this is some sample data that we might acquire, the formatting of how we might lay it out for an older or younger person. Sample data was acquired in an older female between 60 and 69 years of age and a younger male in his 20s. We would express the FEV1 and their MIP expressed as a % predicted. And then for the data that we would acquire, we would list the various variables, the completion times for doing the 9-hole pegboard test, the board dyspnea that they experienced during the test. We may monitor their SpO2. Depending on the apparatus that you have, you might monitor the ventilatory outcomes, respiratory rate, tidal volume, minute ventilation, and some cardiovascular outcomes. And to illustrate the point, what would happen when they did the single task of the 9-hole pegboard test, what happened when we added the loaded breathing, that is the inspiratory threshold loading, and illustrate the difference. And with a younger participant. And usually we pick participants that illustrate the overall outcome of the study that we expect. So you are selecting not quite the star performers, the typical performers. So on to the discussion. The discussion should start with briefly summarizing the merit of the application, the advantage, why is this study needed, for the hand dexterity in people with respiratory conditions or those people that dyspnea, it's just not studied. Often we focus on aerobic strength or mobility of the lower extremities rather than looking at upper limb mobility and hand dexterity. We might look at that when those people have an injury, but not so just in their day-to-day function. And it models the dysfunction of those people with overlying respiratory conditions. So, if we think of someone using an inhaler when they're breathless, but if the breathlessness interferes with their hand dexterity, how could we address that? We would also provide examples or some of the limitations of the study. How does the 9-hole pegboard test pertain to daily activities? Does inspiratory threshold loading relate to the breathlessness experienced in day-to-day activities? And in this particular study, our plan was to only use right-hand dominant persons just because the motor control is a little bit more straightforward when you just use right-hand dominant, but that limits the application to left-hand dominant. So those are some examples of how we might describe the advantages, but also the limitations of this particular study. For future directions, it's sometimes included in the conclusion section, but the future directions for research, it should be one sentence, maybe two max. It could be a suggestion about tweaking the methods, how you might expand or use a different sample or population than what your paper focuses on, what this adds to the body of knowledge. So in this particular example, some examples of future directions would be to use the 9-hole peg test evaluated in patients with respiratory conditions, or we could look at the 9-hole peg test and the ability to use a handheld inhaler. Compare that to the challenges when people use different types of inhaler, like a meter dose inhaler versus a dry powder. So those are some examples. There's not usually a huge focus on future directions, but really what are the next steps? What are the most immediate next steps in using that application, that particular methodology or protocol? And I think I'm getting near the end. So the conclusion, you don't want to overstate or exaggerate your conclusion, but to be conservatively bold. And there again, I won't dwell too much on this because all of you have written research papers, so you've had the experience of not being overstating your conclusion. Other things that you could include in the paper or that's required are an example of the table of materials, equipment, and supplies. This probably pertains more so to the methodology, but it really depends on what novel aspects of your protocol or methods are describing. And just the name, the company. Oftentimes there's very specific companies that you acquire these pieces of equipment from, the catalog number or order number, and then there's other things that they're available from a number of different sources, so you don't have to include as much detail. But really, it's a list of equipment and supplies that if someone was to repeat and do this protocol, what would they need, what would they require to start up the study? Supplemental materials, they're already stated and accepted for this journal. They could include questionnaires, particulars about the analysis of the data, supplementary data, any other special questionnaires, or any other special considerations. And some of the examples you might have, oftentimes we use a baseline study to characterize our participants a little bit more, the depression, anxiety, and stress scale. You could include that and the instructions that you might provide that individual. The Borg dyspnea scale, and as mentioned before, the Borg dyspnea scale is pretty standard, but oftentimes the manner in which people are instructed, participants are instructed to address that scale can vary. But it can complement what you actually described in the text of your protocol or the text of your methods. Okay, so in thinking about developing your paper and putting your paper together, oftentimes I think about the hourglass approach, where in the introduction we start very broad. We have focused information on the topic. It's not a review. What's currently known, what is the gap, and then it gets very narrow where the study aim, purpose, or objective is described. It's also very narrow when you're looking at the methods and the sample or pilot data. The very first paragraph of the discussion, again, is focused on the methodology and the results, but then it starts to broaden a little bit more when you describe its key applications, the advantages and disadvantages. There again, it's broadening the limitations and the future research directions. So in the end, with this paper, whether it's a methods paper or a protocol paper, you want to describe how this methodology is a better way to address questions that need to be answered. Okay, so if you were to provide a phrase to describe how you feel about working towards writing a methods or a protocol paper, would it be smooth sailing? Good things take time? The fog is lifting? I feel like I'm spinning my wheels and looking for a sense of direction, or something else?
Answers are coming in.
Okay.
Oh, we have a 50% split, a perfect 50-50. We have 3 people saying good things take time, and another 3, the fog is lifting.
Oh, good. Oh, well, that's good. I feel better.
So
Yeah.
yeah,
Yeah.
it looks like we all learned something something important today. So thank you, Darlene.
Okay. Well, thank you. And questions. Thank you very much for your attention. It is Friday afternoon, and for some of it, it's getting into the evening. So I thank you for attending at this time. And if you have some questions, I'd be happy to try and address them. Or if Al or Rich have something to say, please chime in. Or any of you. You know, it's a small enough group, we can have a discussion.
I would like to address one thing. The list of equipment that you share, I would consider that as a supplemental material for CPTJ. I know it's important so people can replicate, but that can go as a supplemental material
Okay.
with the rest of the surveys or tools that you use.
Yeah. Yeah, no, I would see it as supplementary material, yeah. Any further
So,
thoughts or comments, or people
exactly.
getting on to the rest of their Friday afternoon or evening? Dinner's calling. And Al, do you want to say
Okay.
a little bit more about how the video is going to be available?
Yeah, absolutely, absolutely. So if you can stop sharing, there's perfect. So thank you everyone for attending. The video will be available soon, so you can share with your colleagues and friends. It's going to be in our YouTube channel. The CPTJ has a YouTube channel. You can go and Google it and follow us. I think that is gonna be up soon. And as I said at the beginning, we are opening this new type of submission in the journal. We will start advertising that, and we will advertise with the link to the video. So please share this with your colleagues and friends, and have a great weekend, everyone. And thank you for coming.
Thank you very much.